Good morning, good afternoon, everyone joining us from across Asia Pacific and other regions. It's very nice to welcome you to the fifth session of the webinar series of Open Science from the UNESCO recommendation to the reality in Asia Pacific. My name is Ferishte Rafiyan. I'm Program Specialist for Science Policy and Capacity Building for Basic Sciences here at UNESCO Jakarta office. Our office is covering the 5 countries of Indonesia, Malaysia, Brunei Darussalam, the Philippines, and Timor-Leste. But these webinar series are open to the whole Asia Pacific, and also, experts from across the region are contributing to them. So before we start, I would like to share a few housekeeping rules with everyone. So we would appreciate if you please rename yourself with your full name and ideally with your affiliation or the country. Please keep your microphone muted when you're not speaking. Use the chat box for your questions and comments. At the time of Q&A and discussions, please feel free to raise your hand if you wish to take the floor. And please note that this session is recorded for documentation purposes, and we will share the recording after the session. So as I mentioned, the idea of these webinars is to basically go from the UNESCO recommendation on open science to the reality. As you know, the UNESCO recommendation on open science was adopted in 2021 after 2 years of consultation and developing this draft with participation from experts and stakeholders of science from different regions and different stakeholder groups. This is the first international standard-setting instrument on open science to enable collaboration among the countries and disciplines. Open science, as defined in this recommendation, is a combination of movements, practices, and principles that promote collaboration and information sharing for the benefits of both science and the society. The movements and practices that help engaging wider society in creating, evaluating, and communication of scientific knowledge, and also ensuring multilingual scientific knowledge is open, accessible, and reusable for all. This definition has different pillars for open science, from open scientific knowledge, which is more the output or the methodologies of practicing science, from scientific publications, open data, open educational resources, open hardware and open source softwares, to open science infrastructures, which we covered in the previous webinar, to open dialogue among different knowledge systems, including the indigenous knowledge systems, and also opening engagement between scientists and societal actors through practices such as citizen science and participatory science, scientific volunteering, crowdfunding, and such practices. In this session, we are specifically focusing on open science research, science data, and I also would like to tell you a bit more about these webinars in the context of a bigger, longer-term project, which is aiming at capacity building for open science in the region through advancing collaborative research for sustainable development, specifically focusing on the field of disaster risk reduction, which is one of the common issues in our countries. And it's also a very interdisciplinary collaborative field of research by nature. As mentioned earlier, when we talk about collaboration, we are talking about collaboration among various scientific disciplines, scientists from different countries, but also scientists and other societal actors. In this project, we are aiming to first understand what is open science, raise awareness on that, and make sure that its potentials, especially in this region, are known, and we know what are the requirements, what are the challenges. This is the aim for these 10 sessions of monthly webinars. We are on the 5th session now. We started more on what kind of science we need to address the societal needs, and now we are entering more the technical sides of open science, this time on open data. And then the next phase of this project, after these awareness raising webinars, would be developing a course on the technical parts of open science, targeting especially young researchers to see how to practice open science in their research. And the last phase of this project would be then bringing together the young researchers from different countries that can co-design and collaborate together from different fields, different countries, and also with the local communities and societal actors to really address some of the scientific issues in the field of disaster risk reduction through practicing open science. We are very honored today to have three very distinguished speakers with us, which I introduced to you. We do have Dr. Yasuyuki-san Minamiyama from Japan, who is a researcher at the Center for Social Research and Data Archives, Institute of Social Sciences, University of Tokyo. We have Dr. Lili Zhang with us, who is a senior scientist researcher in Computer Network Information Center of Chinese Academy of Science. She is also Executive Director of Global Open Science Cloud International Program Office. And we do have Dr. Jacqueline Stepan with us. She is an Associate Professor in Public Health, Regulatory Science, College of Medicine and Public Health, Flinders University, Australia. Very nice to have you all. Thank you. And our audiences today, like always, we ask you, what is your engagement with open science? We are happy to see for the second time that there is an increase in the number of people who are actually participating in open science and a decrease in the number of people who don't know much about open science. We do have a diverse participation, this time increased ratio from researchers and academia, government and policymakers, university lecturers, students, librarians, data archivers, and data managers, and also private sector and international organizations. Very happy to have this diverse participation. We try to keep this session very interactive. Please feel free to share your questions in the chat during the session, but we will also ask you questions for your inputs during the session through some Mentimeter slides. To start with that, we would like to know from which countries you join us today. So please scan this QR code or go to menti.com and enter the code and let us know from which country you are joining. So later we can also relate your answers to our next questions to your context and your country. If I can ask my colleague to share your answers to see from which countries you join us, and after that we will start with the three speakers' talks. Excellent. So we have many participants from Singapore, Malaysia, Australia, Thailand, Brunei, China, the Philippines, Indonesia. We have participants from South Korea and Switzerland, Mongolia, Thailand, if I haven't mentioned. Japan, New Zealand. Very nice. So please keep adding your answers on the slide. Okay, while you do this, I think we can move forward. And I would like to invite our first speaker, Yasuyuki-san, to please take the floor. I have a question for you, and that question is, I would like to ask you, please, to tell us what is actually open research data to start with, and what data management principles are needed to enable effective collaboration and sustainable research systems, especially across disciplines and the countries. Thank you.
Can you hear me? And
Yes,
my
very
slide?
well.
My slide? Okay. So thank you so much, Felix. Hello everyone. I'm Yasuyuki Minamiyama, working at the Institute of Social Science, the University of Tokyo, Japan. Today, I'd like to introduce my current efforts entitled Toward the Establishment of a Research Data Management Framework in Southeast Asia. So first, let me introduce myself briefly. My major is library and information science and knowledge engineering. Especially, I'm interested in fields such as digital curation, research data sharing, ontology, metadata, and open science. I have been involved in designing national-level research data management services in Japan. And furthermore, I have been engaged in practical initiatives to promote open science in Japan since 2014. Today, I'd like to focus on introducing these open science practices. Now, let's move on to the main topic. So first, I will briefly introduce the basic information on UNESCO recommendation open science as a first speaker. Then I will introduce the trends and initiatives in Japan, focusing the research data management initiatives in Japan from a national level survey. And furthermore, I will introduce the ongoing initiatives toward international collaboration. So first, introduction phase. This is same as the first presentation from Felix. I will show only key phrases. Open science is established when scientific knowledge and the process of creating knowledge are openly shared and reused. So among the elements that makes up open science, research data, this point, which is the focus of this discussion, is placed within the open scientific knowledge category. This recommendation sets out how open research data should be, and it also specified the requirement that data be curated in accordance with the FAIR principles. Research data had previously been limited to sharing and reusing among researchers, but these activities have begun to take on social significance. So I'm sure many of you are already familiar with FAIR principles, but I'd like to briefly touch on the overview. These principles are internationally recognized as the most well-known principles for expressing appropriate data sharing methods. The FAIR principles advocate for data to be findable, accessible, interoperable, and reusable. When research data meets the criteria outlined in these 4 areas, we can facilitate the sharing and reuse across disciplinary, linguistic, or community boundaries, probably. So the original scientific data paper has already been cited over 20,000 times, and these principles are increasingly become a norm. And next, I will present an example from Japan to illustrate the impact of this open science trend. So even in Japan, many policies have been implemented in response to open science trends. This slide shows the main open science policy streams in Japan, with the policies related to open science being launched every year since the joint statement by the G8 science ministers in June 2013. And in 2021, the promotion of open science was incorporated into the 6th Basic Plan for Science, Technology, and Innovation. And this plan is a top-level policy document in Japan, and relevant Japanese ministries and agencies have published 2 important policy documents to implement this basic plan. Next, in April 2021, one of the most important policy document published. Unfortunately, and sorry, it's too busy figure to explain the details now. But anyway, the document outlines the concept of a national data platform as illustrated. The important point is the left side, this one. The Japanese universities and research institutions have to manage research data and metadata by their own responsibility from this point on. Another important policy document was published in 2024. This figure is also too busy. So Japanese policy document is such as like a one. But anyway, this policy document mandates supporting data for papers published in institutional repositories or data repositories. Once realizing this policy completely, we will see significantly increasing of data publication in Japan. However, research data management at the university level was still a quite new concept for many Japanese practitioners. For most institutions, it was not clear what service could be established to make this concept a reality. To overcome this situation, multiple communities are collaborating to conduct a large-scale survey for analyzing current research data management services in Japan. The survey of research data management initiatives in Japanese institutions. This survey aims to quantitatively assess the current state of research data management initiatives in Japan and to identify and share best practices in research data management through the survey. As mentioned in the previous slide, the survey is being led by JP Core, the library community, and Axis, which is a community of information infrastructure centers. And last one is NICETEP, a policy think tank. I have been involved in the design of this survey as the JP Core representative. And next slide provides the survey overview that have been carried out so far. The survey is conducted every 2 years with 300 to 350 institutions responding each time. The major survey items are basic information, understanding user needs, status of developing data policies and procedures, status of research data management services, and IT infrastructure. To visualize the survey results, we designed an evaluation model. So this figure represents the 2022 national average based on the designed RDM service maturity model. The model allows for 5-stage maturity assessment on 6 dimensions, corresponding to the major survey items. The figure shows that while awareness dimensions is relatively advanced in Japan, but the other dimensions have only just begun in Japan. So we also conducted the 2024 survey, is the latest one, between November and December 2024. The questions are so valid that I cannot present them all, but I will focus here on the research data management support services. Okay, this slide shows the breakdown of the implemented RDM services over time in Japan. As highlighted in the figure, this point, provision of institutional repository have shown high growth. And look at the left side figure. So around half of institutions have their own repositories as of December 2024. And the reason for this is that Japan offers a national repository hosting service named Gyro Cloud. This Gyro Cloud service has raised the number of institutional repositories held currently about 900 institutions have their own repositories by using the Gyro Cloud. I will explain the more specific Gyro Cloud services. Gyro Cloud is cloud-based repository hosting services hosted by National Institute of Informatics Japan. Gyro Cloud is designed as a service for small and medium-sized universities and research institutions, with NII, National Institute of Informatics, centralizing and managing technical aspects such as server operations in accordance with the situation in Japan. So having said that, there are challenges and possible barriers in actual operation. This question asks about the challenges and possible barriers to share research data through institutional repositories. So institutional repository policy issues and budget issues have decreased over the years. However, awareness and practical issues such as lack of manpower and unsure of appropriate license, difficulty to describing metadata that have increased over the years. To address these challenges and possible barriers, JPCO has conducted various support activities. The three main initiatives are as follows: a collection of research data management best practices, the development of RDM training materials, and the formulation of guidelines. I'll just quickly run through the slides this time. First one is RDM case studies in Japan. To promote research data management at the universities, we first focused on collecting and sharing the best practices with Japan. Unfortunately, the text is very small, difficult to read. But anyway, so we have compiled and published 15 initiatives as a document from the perspectives of research data management support, data publication and utilization, user support, and establishment of management systems. And next, we started developing RDM training materials. To effectively implement research data management in practice, localized training materials and manuals are essential, I believe. And currently, 3 types of training materials have been developed for supporters, such as librarians, and for researchers, and for information infrastructure staffs. The development materials are available on the JPCO website and also available on the Jacqueline LMS as online courses. And last one, I will introduce the guidelines for registering research data in the institutional repository. As mentioned earlier, the supporting data for paper publication will become mandatory in Japan from 2025 onwards. The JPCO has written guidelines summarizing points to keep in mind when registering research data. These guidelines are structured into 4 sections from a practical perspective. Okay, so far I showed an overview of Japan's efforts. Finally, I'd like to briefly touch on the expansion into ASEAN countries. So our background of this effort, so my research group has been entrusted with the YTech project, an international exchange program provided by Japanese funding agency JEST. And in this project, we aim to create opportunities to build, maintain, and develop human exchanges for future joint research between the ASEAN countries. So under this project, we conducted first preliminary survey for ASEAN countries at the PNC, Pacific Neighborhood Consortium International Conference. PNC targets mainly in the humanities and social sciences field, but it attracts participants from many ASEAN countries, and I think it is a good size for gaining deeper insights. Anyway, so this survey focused on the needs for RDM services and the status of IT infrastructure from the survey conducted in Japan, designed to be answered quickly and easily for researchers. And this survey was greatly useful in gaining deeper insights and contextualizing and understanding each case. For example, question 6 asked about preservation services being most in demand in Southeast Asian countries like Vietnam, Thailand, and Philippines. However, data management plan support ranked highest in Japan. Possible reason is quite simple. So Japanese government mandated DMP creation starting in 2025. But important point is other perspective. In order to reconcile the different concerns of each country, a policy level understanding is crucial for properly interpreting the situation. Okay, so this is my last slide. I explained the 3 sections: the introduction and trends and initiatives in Japan, and last one is the expansion into ASEAN countries. I hope my presentation was of some help to you. Thank you very much for your kind attention.
Thank you so much, Yasuyuki-san. Very interesting. And I loved how you captured that these are all connected areas to enable open data, starting from policies and obligations through providing repositories at the national and institutional level to enable this. Of course, identifying the challenges, specifically in capacities, and providing, training for both scientists and those who provide such services for the scientists. These are all elements that are crucial in enabling, unlocking open data, as we call it today. Thank you so much for that. And it's
Yeah, thank you so
also
much.
very interesting to see, like, we start at the institutional level, going to the national, and then expanding through collaborations to really enable this. We don't need to reinvent the wheel. Thank you so much. So as you mentioned, infrastructures are one of the key elements of enabling open data. So I would like to invite Dr. Lili Zhang, our second speaker now, and ask her please to tell us about the initiative of Global Open Science Cloud and how this could be used as a test bed initially for building interoperable and sustainable open science data infrastructures to support both regional and global scientific collaboration. The floor is yours. Thanks.
Perfect, thank you. And Lili is trying to provide the example about how we contribute to the open science implementation from the data infrastructure perspective. And the initiative we have been collaborating is called the Global Open Science Cloud Initiative. And the story begins with the key pillars of open science that has been depicted by UNESCO. And among different issues, you could see that the open science infrastructures, whether they are virtual or physical, they are the fundamental supports for open data and many of other research resources. Honestly speaking, when we try to use different research data, the kind of technical environment will be very important. It depends on whether we will have sufficient computing facilities, whether we will have very useful toolkits, or whether there are a series of different data across domains and regions that can just fit into the research problem we are dealing with. So for the open science infrastructures, they are trying to do something to provide the research environment that you can just have collaborated and integrated research resources all together. Looking around the world, probably you could see that the open science infrastructures are pretty popular in recent 10 years. Like in Europe, the European Open Science Cloud is one of the very good example. In Africa, they have the open science platform. And I heard that in Malaysia, we have the open science platform also. And there are many of the other practices. And under the Chinese Academy of Sciences, we have the China Scientific Cloud. And we see that there probably will be very good practices to enhance the interconnectivity of different research environment to promote the flow of different data across domains and regions. So in the year 2019, there was a kind of a CoData conference in Beijing, and we talk about whether it is possible to develop a kind of interconnected open science cloud that will bridge different gaps and trying to make the open science cloud under the global level happen. And so the vision of this kind of initiative is trying to develop a kind of a global open science cloud environment that different research infrastructures could be connected under a trustworthy ecosystem. And the mission of this initiative that has been started in 2021 jointly by our institute and CoData is to facilitate the accessibility of research resources, interconnectivity of internet, interoperability platform, and inclusiveness of different engagement. So it will develop several things from the technical perspective. From the network, there will be kind of a how to say the enhanced connection between different internet service providers, and based on that, we should talk about how to develop a kind of a peer-to-peer cloud federation kind of a platform that different data could be converged all together for community engagement and for some complex and large-scale research. So it is one of the initiatives we were trying to provide the infrastructure level solutions to enhance the international research collaborations. And to make it visible, usable to our kind of pilot groups, we have developed a kind of a test bed. Actually, there are some of these infrastructures, as I illustrated from the previous slides, that it is integrated infrastructures that are contributed with our partners around different regions. So for part of them, we collect the computing facilities and developed a virtual environment. And based on that, we collect the different open source and free to use software, and it will be tailored into scenarios. So for different GOSC sub communities, they will just have a kind of a virtual workbench where they could use these open source and free softwares to manage the data by themselves or get shared data or share data with others. So the initial idea of this kind of a cloud is trying to make it contributed from all and beneficial to all the community. And the data will be easier getting shared since there will be online coding by the least efforts. And there is one of the case studies we have been engaged in recent 3 years. The example comes from our Kenya partners. And through the kind of open source solutions, we have helped the local university researchers to reorganize their computing facilities for their own. So under a kind of a secure and co-trusted ecosystem, they are trying to manage research resources by themselves. And through the kind of compound solutions, they can manage their virtual machines, and there were kind of clusters of different research resources, and they can use open source software shared through the platform to do their research for particular SDG goals, such as the agricultural sciences, climate change, and some of the others. And besides the technical part, we also understand that the governance of such cloud probably will be difficult, since you could see that from the kind of open science pillars, there are sundry research resources, and for some of them, they probably will be easy to get virtual cloud services delivered to different people. But for some of them, they are probably like your lab materials or something that are not quite easy to get collected and shared. So it depends on the different status, and there should be kind of a unified peer-to-peer standard to better depict this kind of a situation. So we are trying to use the everything as a service model. And from this slide, you could see that it is a in progress task group that we have been collaborating with CoData. You could see more information through the web link. And through this, everything as a model for open science, we are trying to develop a kind of a metadata approach that are both human understandable and machine readable, and it could depict multi-module research resources. This is not only about the data themselves, but also those softwares, platforms, even some of the infrastructure level services that are supporting the delivery of data workflows. And the ultimate goal of this kind of a work group is trying to redefine the interoperability from the research resources, services, and the system levels. So it is still under progress, and we would welcome your engagement if it's possible. And besides, there is another example depicting how we are developing kind of policies under this kind of initiative. As you see that the open science are trying to flagship how we develop every research resources to break the silos. So there are several things we have been doing several kind of policy reports has been delivered, and among all of them, there is one I want to name as an example, is one that we jointly contribute as managing the protected data essentials in crisis situations. And the background is that the UN level kind of publication about the hazard profile, we see that there are a lot of different type of hazards that range from different domains. And from 2022, there are a series of data policy talks on how we manage crisis from the data perspective. So there are a lot of things we are trying to raise, and what's the most important part? So after a lot of discussions, brainstorms, literature review, we try to summarize kind of a data essentials in driving the policy in crisis situations as this kind of a map. You could see that for crisis data management ecosystem, we could see for the preparedness of crisis, people and research resources are the most important. And the management of these things is also very vital. And for people, it refers to the crisis management stakeholders, both in internal and external, and for research resources. It is not only for the data, but also the data services, data infrastructure, so even the data funding supports. And for the operation, it indicates the crisis management process and how we are trying to prepare everything to manage these different research resources. And if we mention how we deal with a crisis, we can't neglect the great importance of how the ICT is trying to reshape our world, like recently the artificial intelligence booming and many of the others. So technological kind of engagement is the next element we need to pay attention. And it refers to all of these different things that could facilitate the intelligible data exploration in crisis and trying to support the decision making in such kind of a timely required situation. And for technology endorsement, we can't also say we need to pay more attention to the ethics. Like for the AI kind of adoption, recently we have been a lot of concern on how to bring the black box out of as a white box solutions that everybody can understand how it is from and how it is drive the direction it drives us to. So the crisis ethics address different ethical principles, values, how we are trying to gather those stakeholders, how we are managing these resources, how the data technologies are trying to be adopted, and what kind of strategies we are trying to manage. So ethics is another thing we need to pay attention. But in crisis situations, these 5 different elements are not enough, because in crisis, it is a kind of a environment that everybody get involved in regions or even global scale. So the communication is one of the very important thing. We need to bring the right information in right time to almost all of the people that get involved. And the last thing is about the trust. One of my colleagues has been blamed that why the kind of framework has the trust part in and part out. Actually, the initial idea was that I think the trust is within the kind of crisis data managers ecosystem and beyond that. Usually for crisis, it has kind of a characteristics aligned with domains, regions, but honestly speaking, many of the the impacts are very broad, maybe invisible, but the trust should be within the kind of a situation, but also beyond. So the trust should include a lot of things like consensus and the converged way, the information being delivered under a sufficient and timely manner, and how we learn from the past and capacity building to better prepared for the future. So there are a lot of how to say, the detailed solutions, how we are trying to use this to protect the essentials in governing the data, like how we get people united with diversified representation, that we really understand each other under the crisis situation, how we really say that the resources are really prepared to particular scenarios, and what kinds of operation the strategy, the management, the governance is really suitable to different hazards that we have been mentioning. It's over 300. And for the data technologies, how can we appropriately unlock these data potentials to support the crisis management, the ethics, the trust, and many of the others? More information is also available in the paper list here. And I think for the Global Open Science Cloud initiative so far, we have been developing kind of infrastructure solutions jointly with our regional partners, trying to share different research resources for data, for software, for platform, for computing facilities. And beyond that, we will also be very glad to call for open collaborations to get more partners going together to implement open science that will be beneficial to the region and beyond. That's it. Thank you.
Thank you so much, Lili, for this comprehensive presentation. It's very interesting to see for an open data context that is really people-centric and builds trust for the people to really be able to work with each other. It's very interesting to see that we cannot just address it from looking at a technology and technical point of view. We really need to look at ethical principles, protect principles. This was very interesting to hear from you. So I would also like to, as you and Yasuyuki-san shared a bit of the challenges also that exist and addressing them, I would also like to ask our participants now to share with us based on their experience of doing research or, trying to access research and data outputs. I would like to hear from them what are the challenges they face in sharing, accessing, reusing, or managing research data in their context, field, or country. We do have another slide that Mentimeter slide that I would like to share. So same way to go. If you have it already open on your computers, you can. Not sure if you see the right slide. No, maybe not. Do you see my Mentimeter slide? Can you give me a sign?
Yes. Yes. Yes.
Okay, perfect. So we would like to hear from our audiences. What are the challenges you see in practicing open data? And if you wish, if you think this is a specific issue related to your field or your country, please also put in in the bracket confidentiality of data. Exactly. And we will hear about that in our next talk. Any other issue you face? Similarity and plagiarism of data. Are we still on the right? We need more challenges. Interaction with communities of different cultures. Yes. We probably touch base on this, but we will also have another session on engagement between science and societal actors and another session between different systems of knowledge. So we hope that we cover this. Avoiding data exploitation by collection and academic use. Definitely this will be answered also in our next session. Sometimes data from government does not match between agencies such as population data. Happy to say that this will be also addressed in the next talk. Standardization of data, sensitive data, not many researchers willing to share because afraid not fast enough to get it published or etc. True. Data quality and context is another issue. Infrastructures, yes, very much. Multi-layered spanning policy. I hope I'm reading that correctly. Balancing the benefits of data openness with policy aims. Not enough and very less open good data. Absolutely true. Not every open data is open data, or not every accessible data is open data. And it was very valid to look at the FAIR principles to see one of the standards based on the context. In the context of indigenous knowledge, we have different principles, care principles. In the context that Lili explained for us in disasters or crisis, we do have different principles. Not many people and agencies are willing to share their data even during disaster period. Data means budget and why it is difficult to be opened. Risk of misinterpretation, absolutely. And this is a very big responsibility for researchers themselves. And we know it needs capacity, time, and budget. Linguistic data imbalance, absolutely right. And especially in the era of AI, this is very important. Efficient data platforms, again, an issue, but we saw that with national or global or collaborative or federated platforms, we can partly address this issue. It doesn't mean that every institute needs to start from scratch. Academic hierarchy reflection on data, this is very interesting. If you can raise your hand and explain this, it would be very nice. Capacity building, data security, integrity risk, tension between open science and data protection, IP rights. We should definitely have a session on this. Okay, very nice. On the point about academic hierarchy reflection on data, if the person who have answered this wishes to explain in a few sentences, please raise your hand now or after the next talk. Okay, as I don't see your hand, I think many of the challenges that was answered can be looked at in a specific context. In the previous sessions, we also asked several times, what are the thematic areas of science that you see are very relevant, especially for Asia Pacific, for open science to really address the issues? And health was the top topic always pointed at. So we are very happy to have Jacqueline Stepan today with us. She would tell us about how open research data is in practice happening in the health sector. And especially in the health sector, I think every single person is involved with this topic, and every single person would like to have access to scientific outputs related to their health problems. And this is, again, an issue that involves people. There is issue of privacy, trust, data protection. So we are really eagerly to listening to you, Jacqueline, on how this happens in reality. Thanks.
Thank you for having me. I'll just share my slides. And hopefully you can see my slides.
Yes.
Great. Okay, thank you, everyone. I am Jackie Stevens. I'd just like to start by saying I have nothing to disclose. And yes, I'm going to talk about open research data in health and give some examples, particularly from the Australian context. I'd just like to start by acknowledging the traditional owners and custodians of the lands on which I live and work as the Kaurna people, and I'd just like to acknowledge their elders past and present. The reason I do this will become a little bit clearer later on when I talk about the care principles. So why do we want open health data? So a typical hospital generates 50 petabytes of data per year, so a lot of data. And much of that data goes unused. It's estimated that 97% of hospital-generated health data is not used to its full extent. And health data reuse is estimated to be worth somewhere around 30 billion euro each year in the EU, and that is expected to increase over time. So we have this wealth of information that can be used but is not being used to its full extent, and we need to think about ways that we can do that. And why would we want to do that? Well, open data in health enables reproducibility. It accelerates discovery of findings and lets us answer much more complex questions than we would otherwise be able to do with traditional research methods. It reduces duplication of research effort. And it can also be used to empower communities to benefit from insights about their own data. And this is particularly important for First Nations and Indigenous communities. And this needs to be done with a particular ethical framework and lens. So the important thing when we're dealing with health data is to continually think about this phrase as open as possible, but as closed as necessary. And that's because we're dealing with people's health data. It's highly confidential and sensitive, and we need to be putting some protections in place to look after that data. So I'm going to use some examples to explain how this is done in Australia. So the example I'm using is called the RAIN study. It's a very famous Australian intergenerational data linkage. And in Australia, we have some very good data linkage infrastructure that continually is improving. And this particular study, I'm not involved with this particular study, but it's so well known and the website is open for you to look at. That it provides a great example. So just very briefly, what is this study? Well, it was established in 1989, and it was a prospective cohort study of pregnancy in Generation 1 parents, and then also collecting data about their offspring, which is Generation 2. Those Generation 2 offspring are now going into adulthood and having Generation 3. Generation 2 have partnered with spouses. So we're now in Australia, they're collecting the Generation 2B data from the biological parents of Generation 3. And they've also gone back and collected information about Generation 0, so the biological grandparents of Gen 2. So it's a huge cohort of data across multiple generations, and it is able to answer questions that are really complex about intergenerational health. But what they have been able to do with this is they've taken the original cohort data and over time looked at ways to expand the data set by linking it with other administrative data that's collected by government. And so what they have been able to do is establish a data linkage system. So this sort of concept of data linkage predominantly came out of this work done in Western Australia. And we now have quite a sophisticated network of data linkage units across the country. It uses the probabilistic linkage methodology to connect that cohort data with education data and other administrative records without sharing identifiable information between agencies. And it houses that data in a highly secure platform. And there is the ability to access that data even if you aren't part of the original research team to answer specific questions that you may have. It allows the researchers to look at life course research that would be completely impossible with other research methodologies. And so this is it's open data in that you can apply to access that data to answer particular research questions, but it's still closed as necessary to protect that data, and it's all de-identified with sophisticated linkage keys to connect all of that data together. So it's a resource that exists with over 200 million records from 50 different linked data sets across Western Australia and Australia. And we have similar setups in each of the states and territories across the country. So we actually have a federated system of these data linkage units. They all sit within each state and territory across the country. We also have a national linked data asset, which is data collected at a national level. And so you can actually take your own clinical research data, de-identify or cohort study or cross-sectional study, de-identify it and connect it across these different platforms to answer really complex questions, linking it in with administrative data sets from the justice system, education, other administrative data sets around social and welfare. And that is done through quite a as I said, sophisticated process with a range of protections in place. This kind of model, as I said, it allows open data, but it sits behind several firewalls. This federated model is something that's continually evolving in Australia, and they're looking at ways to improve the interconnectedness of the different data linkage systems and encouraging researchers to upload their clinical trial and cohort data into the repository so that other people can also access those data sets to answer questions that may have not been otherwise thought of before. So as I said, the purpose of these federated models of data linkage allows the combination of various different data sources. It's able to then be used to answer complicated policy and service improvement questions. It's all the policy governing how this works is organised through this National Health Data Hub. And to access that data, you can create your question, write up your research question, fill in the forms, access that data. There is typically a fee involved with being able to access that data, but it's still that, as I said, open as possible but closed as necessary kind of approach. We have strong governance in Australia that sits behind how that data is stored and accessed. And there's a very clear model of de-identification and separation of identifiers and content of the data. As I said, the data is secure. The data is all housed inside control environments. It's not able to be downloaded onto your external device, so it sits behind several firewalls inside a closed environment. But because of that, it means that you're able to connect all of these really interesting and highly sensitive data types together and answer these questions. And you do all of your analysis and manipulation of the data inside that closed environment that's controlled. And as I said, it allows us to answer questions that are highly complex that we wouldn't otherwise be able to do. So we have a range of different ethical frameworks that then sit around how we access open health data. And it's really important to understand these. They do differ from country to country, from state to state within countries, and it's important to be familiar with the frameworks that exist and what the rules and regulations may be within your own place of work. So as my colleagues have already said, we have the FAIR principles, that we try to adhere to, where we want our data to be findable, accessible, interoperable, and reusable. And these data linkage platforms do allow us to do that in that open but closed way. Across Europe, there's now GDPR rules. In Australia, we have the Australian Privacy Act. These are particular legislations that limit who can and how that data is accessed. So it's important to be familiar with those if you're trying to access open data in other places outside of your own country, and be familiar with the rules and regulations within your own context. In the UK, and they have a range of data banks and data linkage services as well. They adhere to the 5 SAFEs principle, so safe people, safe projects, safe data, safe settings, safe outputs. So a similar kind of approach to ensuring that data is managed in a safe way. And another type of ethical framework that exists is this concept of dynamic consent, which has been around for some time, but basically participants are able to approve what data is included in these kinds of platforms, and they're able to update that or change it over time. So there are a couple of examples that I've provided on the screen, one being the CRIS study in Italy, another one being the Biobank in Norway, which have used this kind of approach and have published about the way they have implemented that. And in Australia, we do have another level of complexity with health data. So not only is health data sensitive and can be quite identifying if it's not handled appropriately, we also have issues around Indigenous data sovereignty. And this is a particular topic of note here in Australia. There is a number of other places where there's lots of really great Indigenous data sovereignty work being done, namely in Canada, some of the other countries like New Zealand, where we have a strong history of white colonization. And I'm a non-Indigenous researcher who does work in this space, so it is important to acknowledge that Indigenous and First Nations people have been doing science for a very long time, but unfortunately at times in history have also been the subject of some very poorly done research and have had some very bad experiences with researchers. And so because of that, and the way their data is handled, the care principles have been devised. So the FAIR principles that we've already talked about alone are insufficient to actually look after Indigenous data in a way that looks after their interests. So CARE, like FAIR, is made up of an acronym. So C stands for collective benefit. So we want the data ecosystems we use to be designed and function in a way that enables First Nations and Indigenous peoples to have benefit from their data. So they need to have a benefit from how their data is used. They need to have an authority to control how their data is used, and must be recognised in having that control. So governance structures that we put in place around the use of First Nations and Indigenous data do need to support self-determination. There needs to be responsibility of how that data is used and shared. And that's not just for the First Nations and Indigenous people whose data it is, but for those of us that are using it who are non-Indigenous researchers. So relationships with communities have to be reciprocal and mutually accountable. And that's really important and goes back to partly why I did that acknowledgement of country at the beginning of my presentation today. And finally, E stands for ethics. So Indigenous people's rights and wellbeing needs to be the primary concern of how the data is used. And so ethics review always needs to include Indigenous and First Nations community perspectives and leadership. And so with a community and human-centered approach, we definitely want to try and be centering community and humans in our research, particularly if we're using First Nations data. Community involvement is not optional, but it is the foundation of ethical and impactful open health data. So I've got some examples here. The first one is the Maori Data Sovereignty Network in New Zealand, where Maori data is governed by Maori leaders, and they are involved in directly influencing how Maori data is reported in their government statistics. And so they have this underlying principle that data collected about communities need to benefit those communities. Again, that echoing those care principles. In Australia, we have the IATSIS Code of Ethics, which is the peak body for Aboriginal and Torres Strait Islander studies. They have a range of documents outlining how Aboriginal and Torres Strait Islander data should be used and how we can do research with those communities in an ethical and respectful way. Centering humans and community doesn't always need to be just for research involving Indigenous communities. It can be also for other groups of people. An example is the Patient-Led Research Collaborative that looked at long COVID, worked with patients to co-design and collect and analyse their own data, and making sure that the research is centering the lived experience of those people who were experiencing long COVID during the COVID pandemic. And another example is the Inclusive Data Charter, which is the an international commitment to disaggregated data to ensure that health data sets capture a range of information that provides a better way of looking at health outcomes to ensure that data is reducing health inequities rather than reinforcing them. And that's another important thing to consider when we're looking at open health data. There's a number of challenges and tensions in doing this between the openness of the data and the privacy and risk of re-identification. As I said, the tension between global data sharing and data sovereignty for First Nations and Indigenous communities. In health, there's the tension between speed of research, but also making sure we have community involvement and consent. That tension between the FAIR principles and the care principles, because sometimes they don't always align, and they both are needed, working with First Nations and Indigenous communities, but sometimes they can actually conflict in practice. And also that tension between publicly funded data, which is what a lot of health data is, and the risk of commercial exploitation of that data. So making sure that there is community benefit and we're not using health data for commercial exploitation. An example of that is like insurance and pharmaceutical companies that may want to try and access that data for financial gain. So just in closing, when we're trying to use open health data, we want to try and apply the FAIR and CARE principles together as much as possible, making sure they're complementary and not competing with each other. We look to try and co-design our research with the communities where that benefit will be seen, and doing that from the outset and not as an afterthought. Trying to use federated architectures to enable analysis without centralizing sensitive data. Building governance structures that benefit the data contributors and the communities that they serve, and trying to disaggregate data to ensure that the data reduces and not reinforces existing health equities that may already exist, particularly for Indigenous and First Nations communities. Thank you so much.
Thank you, Jackie. Very interesting, very inspiring. All the challenges exist. Science is not easy. Open science is even more difficult, but your presentation really shows that it's possible. a lot of things, a lot of good examples to learn from. And as you mentioned, always apply it in the specific context. We cannot copy paste solutions. We have a few good points, comments, and questions in the chat, specifically from Dr. Deva Surendra, sorry. I think they were mainly asked at the time that Lili was presenting, but I will just read them loud, and I invite our three speakers to see where they can answer. First of all, I expect that there would be a list of open source resources, especially in the global open science cloud, where people can access and use them. So please, also the participants or speakers who are aware of such lists, please feel free to share it. We hope that we will have time in this series of webinars to specifically address the issue of open source also. Then there is one question about or a comment that says that it would be sensible to develop LLMs and host them in an independent data center, different from the ones where there are commercial and geopolitical interests interfering with the use and development. And it is important to know where data is hosted and these data centers, who oversights them. I think this issue is specifically addressed through Jacqueline's presentation by solutions such as de-identifying data and opening as much as necessary and opening as much as possible and closing as necessary. But if any of our speakers has any other point to add to this, please feel free to take the floor.
I can speak to that. So in Australia, and similarly in the UK, these kinds of data linkage platforms tend to be housed with government and oversighted by government legislation, regulations, and managed within a government platform for the most part. There are examples where the government has collaborated with a university or an institution, but typically it sits within a government or a university setting.
Thanks. Lili, do you have anything to add, especially in the context of a global infrastructure? Who has the oversight?
Sure. From my side, I think it's a very good question mentioning that the kind of local installation of like the AI tools like the LLM and others. I think that's the private cloud solutions to particular software that is very common in different domains. Like in our center, we are providing infrastructure services to the CAS level researchers, and recently we have been developing kind of a platform that end users could apply particular LLM models and the knowledge are within their ecosystem, so they produce more information based on their own knowledge base. But the running of the model is shared, like from those open sourced AI models. But I think for the recent AI issues, one tricky thing is they are changing and evolving pretty fast. So for the adoption, there should be some very professional and timely technical supports, like from the institutional thing that could support the sustainability and the reusability of these different research resources. And as per the previous question, say a kind of open source tool list. Honestly speaking, from our solution, it is not about a list. It is not the usual traditional way how we manage the data. It is more of an integrated research workbench. So it integrates both shared computing resources virtual machines, open source tools, data all together as a compound solution. So probably there should be some machine readable service deliverable, but it is not a kind of just a simple list. But I think there are several efforts on the way to share like the open source tools in subjects that we can turn to for particular subjects. That's it. Thank you.
Thanks. Yeah, exactly. I think it's not limited to open data. It's about every output or part of the process of science that these principles apply for it to be machine readable, for it to be findable, to be supported by additional metadata and information for the users to be able to find it. So thanks for this. If there is no other question, okay, we have one more question in the chat from Rajak Rahia, which is asking what can be done or how can private research funded by private corporations be integrated to open source? Anyone has an answer for this? I think it is very challenging, and I think the private sector and their regulations would be determining how this can be happening. We are happy to have people from the private sector, and I think for research and for open science, it's extremely important to have engagement with the private sector. In many countries, more and more, a big part of research is happening in the private sector. And Lili from China, which is a good example of such country, has an answer for us.
Thank you. I think you raised a very good question, and that's just take the AI models as an example. Recently, our group has been doing a survey on whether the recent LLM models developing around the world are open sourced or closed things. And actually, you could see that there are both very good examples of open source and the closed model. And for those commercial giants, why some of them are motivated to get the kind of model shared and why the other things are also happening. Usually we see that for a commercial kind of a running of their business models, they should just keep themselves competitive in commercial kind of industry. So closed should be the kind of a priority. But you could see on the other side that this is how to say the most attractiveness of open science. It brings you something new, and very important is the user base. You will learn and get very good examples and trying to how to say get your own LLM models better and better, especially in recent rapid kind of a development for this large AI models. The competition is, I think it is going very fast. And for the open source model, you can just gather a lot of users in a very quick time, and it will be beneficial in other kind of issue, like it is an ecosystem kind of idea, I think. And that is, I think it's also borrowed from the open science recommendation. Why we try to do a lot of efforts to share our data environment software. It is because it is not only you use your software, your data. You want to get benefits to a lot of different domains that probably will be beyond your imagination. So that's the very important value of open science approach that has been adopted in like the AI model developing or something. And it will be beneficial not only to like the social public, but also the developers, the companies themselves.
Thank you so much. Thanks. Yeah, I agree that different stakeholders have realized that there is a benefit in that. Especially you all mentioned the very fast speed of development of technologies and science. So we can't just keep them behind the walls and trying to develop further. So thanks for this. I would like to share with you a small initiative from UNESCO at the global level, which is going on before we close. Yes. So, excuse me for that. I think it was shortly referred to this by Lili, that UNESCO, in collaboration with different partners since the adoption of the recommendation, has been also making some efforts to do capacity building for open science broadly across the globe for different stakeholders, partly through the development of an open science toolkit. This toolkit has different elements from guides, fact sheet, checklists for policy, funding, capacity building, and for one of the recent ones is for data policies for time of crisis, facilitated by Open Science, with three documents, a fact sheet, a checklist, and a guide. These documents see science as a set of data, tools, methodologies, and solutions that is to respond to the crisis situation before the crisis happens through preparedness, policies, mitigation, and preventions, during the crisis through the response and adoption, collecting data during that also, and after crisis through recovery, reconstruction, and learning from what has happened. As a follow-up for this effort that was actually done in collaboration with between UNESCO and ISC CoData, UNESCO is now launching a survey to see where at the institutional or national levels such guides or such checklists are implemented and where are the challenges. First of all, the checklist provides a set of actions to be followed with more details, which include establishing clear objectives, roles, and responsibilities. And for each of them, there is a more detailed how to do. Ensuring availability and access to adequate resources, not just checking one or two, or not just approaching to a specific area. Upholding ethical standards and protect human rights, develop data governance and management protocols in open science frameworks, facilitate open data collection and accessibility, strengthen open data infrastructures for data sharing and storage, strengthen public engagement and communication, promote interdisciplinary, multi-stakeholder, and international collaboration, establishing mechanisms for documentation, monitoring, and evaluation, and planning for long-term preparedness and resilience. So this was, I think, all of this was mentioned today also in the call, in the presentations. Now the survey is aiming at finding the gaps, understanding where and how these it's implemented, open science is implemented or open data is implemented for the crisis situation, and what policies exist, and also identifying the gaps and challenging. And the input that we received through this survey would help us to do better, supporting future policies and capacity building. The survey is targeting different group of stakeholders whose action is crucial for implementation of open data policies at time of crisis. These include research institutions, government agencies, emergency management authorities, public health, charities, funding bodies, non-governmental and civil societies, and many more. The survey will be open next week, so we will send a follow-up email to those of you who are interested to participate, not as individuals, but through your institutions or government or non-government agencies. So this is what I wanted to share before we close, and also invite you to join our next sessions. Many of you have joined our previous sessions. The next session will be on opening dialogue between different knowledge systems. It will be on 30th of April, hopefully around the same time. If you wish to have more inputs for us, please tell us what you need to learn more about open science. Every day, every session, we collect your inputs, but we would also welcome them through emails. Please let us know if you can contribute to any specific topic. And we will also soon send a midterm survey to evaluate ourselves and see how satisfied you are with these webinars and what can improve. With this, I do not have the time on my screen, but we have 2 minutes. If there is no more last point, or if any of the speakers would like to say something very shortly, the floor is yours, and after that we can close. Jacqueline, do you have something to add?
I was just going to say, yeah, open science in the health space is quite challenging, but it can be done. We saw during COVID that there was the ability to change our systems to be able to work more collaboratively in a slightly more open way, but it does remain to be quite a challenge in the health space. Yeah.
Thank you. Yasuyuki-san.
Yeah, so thank you for this valuable opportunity. So again, I'm happy to collaborate or cooperate the ASEAN countries survey, and let's analyze and address the common issues.
Thank you.
Thank you so
We
much.
count on that. Thank you. And Lili?
Thank you, everyone. And I enjoy and will be enjoying this open science travel with you all. Thank you.
Thank you so much. Thanks everyone for your attention and participation in this session. Looking forward to see you next month. Bye.